Anemia is a type of anemia caused by a bone marrow disorder. Many disorders, such as leukemia and myelodysplasia, can induce anemia and impact the bone marrow, causing the formation of red blood cells to decline or halt completely. Hemolysis anemia is a type of anemia caused by the breakdown of red blood cells. Red blood cells are destroyed quicker than the bone marrow can create new blood cells, resulting in this type of anemia. Some diseases can cause infection. Immune system disorders that cause the production of antibodies against red blood cells and their premature destruction are examples of diseases that can cause significant damage to red blood cells. Sickle cell anemia is a type of anemia characterized by the presence of sickle cell anemia is a type of anemia that is inherited and mostly affects people of African descent. It is caused by an imbalance in hemoglobin, which causes red blood cells to form sickles and die prematurely. Risk factors for anemia. Anemia can be caused by a variety of factors. Malnutrition. Many people's diets are deficient in iron and other vitamins like folic acid, raising their risk of anemia. Irritable bowel syndrome, IBS. Some bowel disorders, such as Crohn's disease and celiac disease, can cause a deficiency in the food and vitamins it contains, leading to anemia. Periodic cycle. Due to the loss of blood during menstruation, fertility women are more likely than men to develop iron deficiency anemia. Childbirth. Because the fetus requires iron and hemoglobin for growth and development, pregnant women are at a higher risk of iron deficiency anemia. DNA. If a family member has a type of anemia that is passed down through the generations, such as sickle cell anemia, anemia can sometimes be passed down genetically. Anemia's complication. If anemia is not treated, it can cause a variety of problems, including the following. Excessive fatigue, when a patient is exhausted to the point where he is unable to perform basic daily tasks, such as playing or working. Heart problems. Anemia can cause a faster heartbeat to compensate for a lack of oxygen in the blood, and in some cases, it can lead to heart failure. Damage to nerves. Vitamin B12 is required for normal nerve function. Cognitive changes. A vitamin B12 deficiency impairs brain function. Death. Sickle cell anemia has serious medical consequences, and large blood losses in a short period of time can result in fatal anemia. Anemia is diagnosed when a person has a red blood cell count of less than 100. Knowing the patient's medical history, a thorough physical examination, and blood tests, including a complete blood count, can all help to diagnose anemia. There are a few things to keep in mind. Males' normal red blood cell counts range from 38.8% to 50%, while females' normal red blood cell counts range from 34.9 to 44.5%. Males' normal hemoglobin values range from 13.5 to 17.5 grams per deciliter, while females' normal hemoglobin values range from 12 to 15.5 grams per deciliter. Blood cells are examined to see how big, how round, and how bright they are. Performing these tests aids in the accurate diagnosis of a condition. Red blood cells are smaller and paler in iron deficiency anemia, and larger and fewer in vitamin deficiency anemia. Treatment of anemia. Anemia treatment varies depending on the cause, which can include iron deficiency anemia treatment. In most cases, iron supplements are used to treat this type of anemia. Vitamin B12 injections are used to treat anemia caused by a vitamin deficiency. Anemia caused by chronic diseases. This type of anemia does not have a specific treatment. Aplastic anemia treatment. This type of anemia is treated with intravenous blood transfusions to boost the body's red blood cell count. Chemotherapy and bone marrow transplantation are used to treat anemia caused by a disease of the bone marrow. Hemolytic anemia treatment. Medications are used to suppress the immune system, which attacks red blood cells. Monitoring of oxygen levels in the body, as well as pain relievers, are all part of the treatment for sickle cell anemia. Preventing anemia. The following can sometimes help to prevent anemia. Consume foods high in iron, folic acid, vitamin B12, and vitamin C. Insistence on eating iron-rich foods, particularly among certain groups, such as children, pregnant women, and vegetarians. General blood tests every few years, as recommended by your family doctor, to feel safe and avoid anemia.